Cancer occurs when cells don't grow in the typical orderly fashion of normal cells. They grow out of control, and the body can't control this type of growth. The cancer cells sometimes can migrate away and deposit in other parts of the body. This is called metastasis. When cancer is treated and the cancer comes back, this is called a recurrence. Colon cancer is cancer that starts in the colon. The colon is part of your gastrointestinal system. This system begins with your mouth, where you swallow food, and then it proceeds through many areas, such as the esophagus, stomach, small intestine, and eventually into your colon. This part of your GI tract is responsible for absorbing water and any remaining nutrients. The waste becomes firmer as water is absorbed and is then stored in the rectum and leaves the body as stool. The cancer starts in the colon wall, specifically the inner wall. The wall has 4 layers, and as the cancer grows, it extends outward through these layers. Typically, the cancer cells grow slowly, usually starting as a polyp or small tissue growth from the colon wall, and it takes several years to develop into a cancer. Many times, colon cancer does not have any symptoms at all. Other times, the symptoms of colon cancer can be vague. Symptoms when present include change in your bowel habits. You can experience constipation as the tumor grows into the colon and starts to block the stool passing through, or diarrhea, since the stool must be loose to pass beyond the growing tumor. Colon cancer can also cause bowel symptoms, such as a feeling of incomplete evacuation or smaller, malformed, ribbon-like stools. The important point is that it is a change from your typical bowel habits. Blood in your stool. It may be red and quite noticeable, but typically it makes your stool much darker in color and tends to be more subtle. Fatigue, lack of energy from anemia. Your blood count, or hemoglobin, becomes lower as you lose small amounts of blood. This is called anemia. Your body needs hemoglobin to carry oxygen around to your tissues. If your blood count is low, you will have less energy. You might not be aware of the anemia, but you may complain to your physician of being more tired. Weight loss. Unintentional weight loss may be another symptom. This is a symptom of many types of cancer. Abdominal distension, bloating. This may also be secondary to the tumor starting to obstruct the lumen of the colon. You may have a decreased appetite due to the bloating, and this may contribute to the weight loss.